I think this is actually going to capture 2 recordings. So if you're going to go back and review, there'll be 2 recordings to review. All right. All right, here, this is the first of, I think, 7 articles that I kind of grabbed a little bit randomly in a search of EBSCO host, just to give you some idea of what a problem introduction looks like. Okay, at least the problem in the general context. And so this article is about the clinical problem of delirium in critically ill patients. It happens to be a systematic review with meta-analysis. And first you see here the abstract, which again, I encourage you to read, but in terms of getting evidence out of the article, I would want you to get that out of the actual article, not the abstract. Okay, so here's where the introduction begins, and they start right off the bat talking about the problem, how frequently it occurs or how prevalent it is among the critically ill, and consequences associated with poor clinical outcomes, such as lengthened mechanical ventilation and hospital stay and increased mortality. And then you can see they cited 6 sources here, credited 6 sources with the evidence in that one sentence. Okay, and then they follow that by saying that patients may experience functional decline. So they give you consequences of the problem and long-term cognitive impairment as a consequence of delirium. Then they cite sources 6 and 7. And you should be able to go to the reference list then and see what those sources are that they cited for that problem. And then they kind of move into their solution that they were testing, which is haloperidol. They were interested in the impact of Haldol on delirium in the critically ill. Okay, so you can see that essentially their introduction of the problem in its general context was only 2 sentences. They jam-packed a lot into those 2 sentences. Now they're using a different citation style than you're required to use. You have to use APA editorial style, so your citations would be in parentheses with the author names and years of publication rather than using this superscript format. But if we want to see what types of sources they cited, and presumably, and I'm hoping that they've cited primary sources of evidence here, because that's what you need to do. Whoops, I'm going to scroll to the, they got a really long reference list. And you can see, okay, so these are the sources that they cited in the problem introduction. Okay, to support their, and you can tell by reading the title of this first one that it's a report of an empirical study about the mortality associated with delirium. It's a little bit old, 10 years old. And then they have another one, the impact of delirium on survival of mechanically ventilated patients. Some of these may be reviews or systematic reviews because delirium's been studied for a really long time. So as far as finding new primary sources about the problem of delirium itself, you may or may not find that. Okay. All right, so any questions about this article? Okay, now I'm not showing you these articles because they're the types of articles that you need to write your problem introduction, because a common mistake that students make is they try to write their own problem introduction based on the problem introduction written by somebody else. So this information right here is, as you're reading it, it's secondhand information in this source. Okay, because this author has cited these other sources. So if you were to extract this information and incorporate it into the problem introduction of a paper that you were writing, you would be in a situation where you'd be using secondhand information and you'd have to use secondary source citation, which is something you want to avoid. The primary source information in this article is going to be the findings of the of the systematic review. Here they're describing their methods for doing the systematic review. And then eventually, section 2.6 is where they synthesize the data. So from this point forward, you're going to find the analyses they did. And then eventually their conclusions that they make about haloperidol and delirium in the intensive care unit. Okay, and the next source is about the problem of pulmonary aspiration associated with procedures. Okay, and mainly I picked it just not because someone's doing necessarily has a PICO question that stems from this problem, but because I just want to show you how authors introduce a problem. And we start off with the abstract and we get to the introduction. Okay, and they start off just by saying pulmonary aspiration. They immediately start off with the actual word that represents the clinical problem. Okay, it's a fear and anesthetic complication, presents a significant risk of morbidity such as pneumonitis or aspiration, pneumonia, and mortality. Okay, and then they cite a couple sources there to back up this claim. Now, the first sentence, they don't cite a source, but I think that would be considered a statement of common knowledge. You know what? In general, pretty much everyone would understand that aspirating any substance into your lungs is a feared complication, whether it's associated with anesthesia or not. Okay. Then in the third sentence, they go on to factors or risk factors that contribute to paraprocedural aspiration events, making the claim that it's important to identify them so that they can be prevented. And then, let's see, they kind of make a few more claims that don't warrant source citation. And then they start to build the reader up for the issue of lawsuits. And then they kind of go into what's known about that problem, citing a study of 106 closed malpractice cases. Mentioned only one aspiration case. So this one, it's not a real strong introduction of the problem of aspiration. You basically got one sentence out of that, but you can see how they're kind of building you up for something else. They're building you up for the work that they're going to report then in this article. Okay, so they get down here to telling you how they did the work and then what the results were. So in this results section, here's the primary source information that this article has to offer. All right, so if you were making claims about pulmonary aspiration and lawsuits, then you'd find some primary source information in the results section, in this section. Okay, but the reason I'm showing you this article is just to give you some sense of how authors introduce a problem. Okay, then we go to Johnson. And Johnson's article is about post-extubation dysphagia, which is the problem, but they're proposing the use of a screening tool for patients after prolonged endotracheal intubation. But, so we get down here past the abstract to the problem introduction. Whoops, I skipped by it. Okay, so they start out with the notion of endotracheal intubation to support mechanical ventilation, that it's frequently used in critically ill patients, and why it's used, but they note that it has complications. Okay, those complications happen to include dysphagia, and then they explain the cause of this dysphagia or the possible reason for it. And then they mention that the incidence of post-extubation dysphagia in mixed populations of medical surgical patients is 3 to 6%. Now, one thing I don't care for regarding this introduction is they don't cite any of their claims until this sentence. So from my perspective and from an APA style perspective, the only claim that's being credited to a source here is this sentence. The rest of these are not credited to sources, although, and they clearly did not originate in the author's own mind. Okay, so and some of these claims might be considered common knowledge, but this definitely here, this post-extubation dysphagia is attributed to mechanical and cognitive factors that interfere with the ability to execute an efficient and safe swallow. I think that should be cited. Now, it's possible that all this information up to this point came from this single source. And this journal may allow citation after the end of several sentences and call it good. But for your work in this class and at Allen College in general, you need to make it clear what the source of each of your claims is. Okay, and so what the authors could have done is maybe marked a beginning boundary. So they could have made it clear to readers that they were citing information from source one, wherever that information began, like maybe right here. They could say, according to Brown and Smith, ETI is a life-sustaining technique. However, complications including dysphagia can manifest. And then they could make it clear that they are continuing to borrow information from that source. Okay, but they do eventually go on to, they do cite this next claim, they credit it to that source. So I guess I'm just a little confused by why they didn't cite like this sentence, or this sentence right here, because to me, it does not appear to be something that would have originated in that author's own mind, and it's not common knowledge. Okay, and then they do cite another source, number 2 here, regarding the risk of post-extubation dysphagia developing, when it's going to develop. And then finally, they end this main introduction of the problem with the fact that studies have shown that prolonged ETI is an independent predictor of post-extubation dysphagia. Okay, so not very many sentences there. But clearly, I mean, it's an interesting and logically organized introduction of the problem. I'm just uncomfortable with the lack of source citation in the early part here. Otherwise, well written. Just wish it was demonstrated more thorough citation. Okay, and then we go to Mina et al. This one is about complex regional pain syndrome, which is something that can happen after you have a distal radius fracture like I had. And in fact, I'm actually on high-dose vitamin C because I was having a lot of pain starting 2 weeks after I had the fracture repaired surgically. And so they were putting me on the vitamin C to treat or prevent this complex regional pain syndrome, or thinking that that might be what I have. So anyway, that was why I was interested in this article. But again, the point is I want to show you the introduction of the problem, which starts right here in the right-hand column. Okay, you can see they start out by defining complex regional pain syndrome as a devastating condition, common after particular things like a distal radius fracture. Then they go on to describe the incidence, and then they cite a couple of sources here. Okay. I think this first sentence could probably be considered common knowledge among the readers of this article. Okay. It's probably noted several places, so it's probably okay that they didn't cite a source there. And then they go on to define it more, the symptoms of it, the etiology, and prognosis. And then they move into the fact that it's a common cause of lawsuits and workers' compensation cases. Moving on to their point that it's important to prevent it, which leads them into the preventative measure, which is vitamin C. Okay, so basically the introduction of the main problem kind of is right here in this first several sentences. And you can see they got by with citing 3 sources there. So just another example of a problem introduction. Okay, and then this next one, characteristics of hospitalized patients screening positive for delirium. This is another report of a study where it's implied by the title that they described characteristics of patients who end up experiencing delirium. And so we're going to expect in the introduction that they have introduced the problem of delirium. Okay, and they certainly have done that. They said it's common in inpatient settings, and they give you an estimation of the rate of delirium in hospital settings for older adults. They cite a source, and then they make another claim about delirium and the elderly. The percentage of patients with delirium in the elderly is 56%. They cite another source, and then they're very consistent about citing sources here, which I like. Now the repetitive citation of the same source after a series of sentences is more awkward in APA style because you have those parenthetical citations. So what they could have done here is maybe marked a beginning boundary and cited the names of the authors of this source. And then the way their writing would unfold would indicate to readers that they're still citing information from that source. And then they could, end the last sentence where they've finished extracting information from that source with a parenthetical citation of the authors. Okay, but you can see that if you read through this, the moves they make or the strategies they use to, I'm sorry, I didn't mean to jump ahead like that. The strategies they use to describe this problem of delirium. And it looks like, they're drawing information from like 4 sources. There's sources 3 and 4 in the reference list. And that builds them up to the purpose of this paper. And they're basically thinking that delirium is underdiagnosed. And that probably builds up to some sort of purpose statement, like the purpose of this study was to describe the risk factors for delirium or characteristics of delirium. Oh, yeah, here's the purpose statement. As a result, data are represented in this article as either the number of patients. Oh, no, that's not it either. Variables. I'm trying to find their purpose statement. Oh, here. The study aims to take a novel approach by examining the whole house of delirious patients rather than a subset by age, diagnosis, or location. So all of their introduction here led up to that. But really the problem itself, delirium, the main problem was introduced in the first part of this paragraph, or first paragraph of the paper. Okay. Couple more here. This one is about the problem of psychosis and its relationship to cannabis use. We got an abstract. Ooh, long abstract. Okay, instead of the heading introduction, they use background, and they're starting out. In this case, they describe cannabis use, and I think the point is that this article is that they're going to describe an association between cannabis use and psychosis. So, to make the case that cannabis is sort of exacerbating psychosis. But they start out talking about that and then its relationship to psychosis in specific types of patients. So that's the gist then of it. They don't focus just on the problem of psychosis because that would be a really broad thing to try to describe because there's so many different types of psychoses and causes. So their problem then is framed as, I suppose, cannabis exacerbated psychosis. And again, they're using a different citation style, but it still involves the use of numbers, except instead of superscript numbers, they're in brackets. Okay, and then the last one is about, oh, it's again about complex regional pain syndrome. So we'll just quickly look at the introduction of the problem here. And they start out again by, they define the problem, when it occurs, who it occurs in, symptoms of the problem, its etiology, here more symptoms, prognosis, and one of the consequences, which happen to include lawsuits apparently and workers' compensation cases. This article sounds, the introduction is very similar to that introduction in that other article that we looked at. Kind of makes me suspicious, but anyway. So questions about introducing the problem in its general context. You kind of get the idea from these examples of what I'm expecting in the problem introduction assignment. It doesn't have to be real long. It's, you know, you can accomplish it in a couple of sentences, possibly 3, 4, certainly not more than, you wouldn't need more than half a page. That would be a long introduction of the problem in its general context. Okay, I am just going to go back to the PowerPoint because I want to make sure I show you those references that we just looked at. Oops, and of course I'm all the way. Yeah, so these are the sources that we just looked at. And then the last page of the presentation is just the readings that the presentation was based on. So I'm going to go ahead and end the PowerPoint and bring back up the agenda. Well, that's the instructions. Yeah, there's our agenda. Okay, so have we covered all of this? One of the next things I would like to do is talk about your discussion 2.1 responses and the things that you listed as sources of external evidence from primary sources and your internal evidence that supports the notion that there is a problem in the setting. So this will be good because there's only 3 of you, and so we've got plenty of time, so we can do that. So why don't I don't care who wants to start. Up to you. It looks like we got 4 people here, so why don't we just go in alphabetical order, and Alicia, you can start and just talk about your module 2.1 discussion posting.
I don't have it in front of me, but
that's okay.
What I posted about my PICO question was nursing retention and mentorship or preceptor. I don't know what search term would be the best to use. That was part of my discussion, as well as, you know, trading out certain words that would find me the right results. But basically having one kind of steady or 2 kind of steady people in the orientation process, or, you know, throughout their first year of practice at the hospital, to go to for resource and questions and orientation and stuff, versus having multiple preceptors.
Okay.
And for internal background evidence, I basically said that I could go to like HR and find out what the turnover in the hospital where I've worked that has one, and versus the hospitals I worked where they don't have that, and also use like satisfaction scores from the staff, and also comments in those kind of pollings if I can get that information, as well as going to my manager and finding some information there, as well as, comments and stuff from other employees and things. And then for evidence search wise, I just discussed searching for nurse retention things and the causes of problems and possibly my PICO areas being part of that source of the problem.
Okay, it sounds on track to me. I think I'm just going to read I actually logged into the course and found your discussion postings. So I'm just going to read your PICO question. In hospital nursing staff, how does mentored orientation compared with multiple preceptors affect nurse retention in 1 year? So like nurse retention or perhaps attrition would be the clinical problem there. And I'm not sure which, you might want to use all those keywords to get at that problem. And then we've got it's kind of complex with your intervention comparison. So you're looking at, mentored orientation. Okay, so there'd be a difference between a mentor and a preceptor, maybe. So they'd be assigned a mentor.
They called it different things in different papers that I looked into. So I foresaw that being a part of a problem in, finding the right, the whole picture. Because, some people would call it mentoring, some people would call it preceptoring, some people would call it, different things.
And you'd probably end up needing all those terms.
Okay.
And you'd connect them together. I'm going to guess the reference librarian would advise that you connect them with or, the Boolean operator or, because they would all kind of be possible synonyms of each other. And if you connect them with or, then the search is going to grab literature that's got that information in it, and you won't miss anything. Whereas if you connected them with and, you might not get much because the sources wouldn't have both terms, mentor or preceptor. So yeah. And so you did what you described with internal evidence. I thought that was right on target. That would be just exactly, what you need. And you may, like you say, get what you can before the problem introduction assignment. You can just cite it as personal communication, but if nothing else, you've got your personal observation and your personal experience to characterize the problem in the local setting. So, okay, very good. All right, so the next person would be probably Courtney.
Okay, so my PICO question was, in ICU new graduate nurses, how does a supplemental education program with orientation compared with on-the-job training alone affect nurse-reported confidence levels within 6 months of orientation?
Okay.
As far as internal evidence, most of that came from my own experience being a new graduate nurse in the ICU setting. And then I was a class of 2 other nurses fresh out of college came with me to the ICU that I worked at. Since then, pretty much all that we have hired every year has been new graduate nurses. And we're kind of feeling that stress now that tenure is much lower. And there was a night this past week where I was the most tenured and I've been there for 3 years. So just from own experience and the experience of other people, I also had the opportunity to orient a new graduate nurse to the ICU and was her main preceptor for 12 weeks. And during that time, she described the same things I was feeling. And now that she's done, and even 6 months after she's been done, she doesn't have the most confidence in taking care of critical patients. So as far as external evidence, I was able to find some things. I definitely noticed that having a librarian to help you structure a bit better would be very helpful. But I did find some articles that kind of talked about the same thing I had found of these nurses once they're done and their experiences, as well as what other places have done to implement orientation modules for extra education for these nurses. I come from a facility that all we do is on the job training, and we have no extra educational background. And the NCLEX doesn't necessarily prepare you to take care of critically ill patients. They prepare you to pass boards. That's what you do for your undergraduate. So that's really where my problem came from.
Sure. Yeah, I think, get right on track there for your internal evidence. And let me just look at your PICO question. Supplemental education program with orientation. Yeah, that's going to be something you're going to have to sort out to figure out what's going to get you your literature and on-the-job training. I don't know if there's a specific term for that or not, but yeah, definitely look at the articles you have that you think are on track with what you're looking for, and you can glean key terms from those articles for sure. Now, regarding your external evidence to describe the problem, I'm kind of looking at this, and so the some of the sources you found, are they about what it says? One's a qualitative single study in which concept mapping was implemented during the orientation of ICU novice nurses. Effectiveness of improving critical thinking skills was evaluated. See, I'm thinking that this literature is going to relate to your solution to the problem.
Yeah.
For intervention, it's going to answer your PICO question. But for the problem introduction assignment, you're going to want to also external evidence about the problem of nurses leaving within the first year. So this study is probably not going to provide you with first-hand evidence of that. The researchers have probably described that problem in their introduction, and they've probably cited sources that might give you some clues of where you could find primary evidence of the problem. I know, like from the American Association of Collegiate Nursing, they keep statistics on, I'm not sure if they keep statistics on turnover. They might. I know those statistics are kept by someone, like first year attrition of new grads and that sort of thing. But so you're going to want to find sources that provide you primary evidence to describe that problem. Because if you try to get it from your sources that have primary evidence about the solutions to the problem, you're going to end up with a secondary source citation situation. Does that make sense?
Yeah, that makes sense. I was looking into things like Pat Benner, novice to expert nursing, knowing that that's your baseline, and then looking at how many nurses are entering into critical care, which is actually increasing. And so therefore, that's some of the evidence saying they're going into this not having necessarily the best educational background or the best baseline to start with to take care of critically ill patients, and then after that does just that on the job training versus the other.
And some of those sound like good sources of explanations for why there's that attrition is occurring. But as far as hard facts or hard statistics on the attrition statistics, that would be something important to include in that problem introduction. How many nurses are leaving their jobs within the first year? So So yeah, so you need like primary sources of that. And I think those, the AACN and possibly the NLN might keep those statistics. I haven't like dabbled in that area for a while, so I'm not sure what the best source would be. But I mean,
Okay.
you know, in this case, this is where I think maybe a Google search might be productive. If you just would go in and Google nursing job attrition or something like that, new nurse job attrition, or whatever the popular term is. I think you might get some stuff right up at the top in your hits that would help you or lead you in the right direction there. All right.
Okay. Yep.
Okay, I'm gonna get out of this part, and then let's go to Malkin.
Hi, my PICO question was in adult inpatient mental health patients, how does having time to go outside compare to indoor only groups in depression and anxiety levels over the duration of the patient stay? I think for my internal evidence, a lot of it is personal observations. So like talking with patients, having patients just kind of bring it up. And then also our unit is opening up a courtyard for patients, but we have kind of uncertainty among staff about like the safety of it, and then also what exactly we'll be doing with it to make it actually helpful for patients. And then external evidence. When I was looking for external evidence for the discussion question, I was kind of looking for things that help me find more articles. So like what terms do I need to start using that is common in the literature so that I can better find articles I need or want.
Good idea. Yeah. Okay. So, okay, and it looks like, I mean, I'm looking at your posting under the heading, describe the sources of external evidence about the clinical problem. And you start, in my initial search for external evidence, I found several articles about various forms of outdoor therapy for patients. So again, that outdoor therapy is the solution that you're wanting to implement. So, and it's the thing that you want that to help, that you want to describe as your problem. Okay, so, and this one's maybe a little tricky because I guess I'm not sure, did we decide what the clinical problem is? I'm going to look back at your PICO question. Depression and anxiety levels. So your description of the problem would need to incorporate depression and anxiety in mental health inpatients. You see what I mean? That's the problem, and going outside is what you're thinking would help them maybe self-manage that or would reduce it somehow while they're in inpatients. Or maybe there's some other evidence out there that inpatient mental health inpatients have higher rates of contracting colds while they're in the hospital, and confinement is possibly the reason for that. So maybe going outside would help. I don't know, that you need to like zero in on what the problem is, and that's how you want to start your problem introduction assignment, with the problem and what it is and how prevalent it is and what its consequences are, because then that leads you to what you've observed in the local setting or what you know about the local setting. And then that leads you to your PICO question, where you can find maybe solutions to this problem, and perhaps those solutions would include being able to go outside. And I think like in my response maybe to one of your questions in the questions forum, we talked about or I mentioned that, even if you don't have patients that are complaining because they can't go outside, or you don't have a specific reason for wanting to implement this, if it's something that's being done in other mental health units, if it's like becoming a trend across the country and it has documented evidence of benefits for mental health patients that are inpatient, then the problem could be the failure of your facility to be implementing that practice. So you could approach it from that direction if if you don't have evidence to support the notion that depression and anxiety are a particular problem in the unit that aren't perhaps being addressed by some other part of the treatment in the unit. Does that make sense?
Mm-hmm.
Okay. All right. I'm gonna click out, and we should have one more person. Carly.
Yes. So my practice problem that I've been exploring is post-operative nausea and vomiting.
Okay.
And I've been like kind of reshaping my PICO question because I kind of felt guilty to the initially targeting my approach based on an intervention rather than the practice problem. So yeah, I've kind of reshaped my PICO question to now I've made it in post-operative patients. How does the use of non-pharmacological interventions compared to usual care affect nausea and vomiting within the first 3 days after surgery? So for internal evidence for my discussion post, I talked about how the EHR is a good source for finding data in that. There's a lot of collected data in that perspective because we chart on patients experiencing nausea and vomiting and interventions that we do for that. And then also consulting with my nurse manager to discuss patient satisfaction surveys, any sort of like quality improvement projects that have been implemented in the past related to this topic as well, and overall discussion with other providers and nurses, and my firsthand experiences with patients working on a post-surgical unit and post-operative nausea and vomiting. Okay. And then for external evidence, I really like EBSCOhost, and I had quite a bit of success when I used EBSCOhost. I've recently been playing around with it too, and they have this mesh 19, and it helps you narrow down, determine how to best search for your topic. So I would type in post-operative nausea and vomiting, and it gave me a cue to what to type in my search engine, and I was able to find quite a bit of sources based on that to describe the practice problem in the general context. I also talked to, when I set up my time with the librarian, I'm in Rochester, Minnesota. So I consulted with the librarian here at Mayo Clinic, and she kind of gave me access to their databases, which is similar to our EBSCOhost, with the CINAHL and all of them. But I was able to find some really good articles through there as well that I'll be able to use. But awesome. Yeah, just redirecting the approach to focus on the practice problem was just challenging at first, because I kept in my head thinking intervention, but that's what we're ultimately trying to figure out at the end of all of this. So
I think the mesh 19 that you're talking about is possibly the Medline mesh terms.
Yeah, I had never really paid attention to that in EBSCOhost before. I thought that was interesting. There was a little tutorial about it actually on there.
Yeah, you'll find out as we move along here that they're basically mesh terms are like a subject heading. They're medical subject headings, and they have a taxonomy or a thesaurus of terms for PubMed and Medline, and then CINAHL has its own taxonomy or list of subject headings as well. So like, I'm not sure there's a term, a subject heading for post-op nausea and vomiting. There might be now, because I think it's probably pretty common, but, and sometimes the terms are the same regardless of whether you're in CINAHL or Medline. But, and then like PsycInfo, I think has its own list of subject headings. But when you build your search strategy, you'll want all the relevant subject headings out of the databases you're going to search, plus any other synonyms or keywords that reflect those subject headings and vice versa. So, but that's good that you can work with the Mayo library staff, because I'm sure they're highly experienced in doing and assisting people to do systematic reviews, which you guys are not expected to do a systematic review, but they will know how to help you build your search strategy quite well. So
yeah, she was pretty excited. I was just explaining to her kind of like, yeah, the purpose of everything, and she was all in. So that was very helpful. But
and hopefully your efforts will turn up some primary sources of evidence simply about the problem of post-op nausea and vomiting. So
yes,
you can get an idea of what those sources will be just by reading the introductions to the articles about interventions for post-op nausea and vomiting. You can get some clues and, you know, use their reference lists to get you to those primary sources if needed. So
yeah, I think it's the challenging part has been so far is like the complications aspect. Like you're showing us example of the articles, and like you said, there's a lot of like when I read like their introduction to the problem statement, you know, they're like talking about, you know, all these other sources, what they had said about the topic, and then they conduct their studies. And I found a lot of things on like incidence and prevalence and risks and such, but finding the complications have been kind of challenging to find evidence of like study.
I don't know that there are a lot of complications of, I suppose, dehydration could be, but
yeah, and like cost, like that's some of the things I found, just like prolonged hospital stays, like just.
And you guys don't have to cover all of those realms of complications. Just, you know, cover the biggies. You don't have to, because you probably aren't going to find, you know, stuff about the cost of post-op nausea and vomiting, because it's probably doesn't last that long.
Right.
Treat it and it's gone, and it doesn't probably end up in prolonged hospital stay, but unless it was some extraordinarily severe case or something. But, just the general idea of the complications and risk factors and stuff like that. So you don't have to cover every single one of those possible characteristics of a problem. Okay, well, let's see, what is, all right, I think we've gone through the agenda. We have. I guess at this point, I'll just entertain questions if you guys have them, and if you don't, then we will be done.
I have a question. I posted this to the questions form like shortly before this lecture, one of mine. I was reading your discussion with Jessica about like a introduction, like having an introduction to this, technically an introduction assignment. So from my understanding, there won't be like a, you know, like a specific introduction, because this paper is about the problem introduction. But my question is like, so an APA on that, the first page after the title page, you know, like at the titles at the top, and then that's usually like underneath you have your introduction there. So if you do not have like a formal introduction in your paper, do you still put that title up at the top? Like if I'm using headers, okay, so I'll just put the title and then put my header underneath of it.
And the introduction to the problem is a formal introduction to a paper.
Oh, okay. So
I mean, you noticed all those journal articles we looked at.
had that. Yeah.
That's how they started. They started by introducing the problem. That's their formal introduction. And I think, you know, in general, I'm sure you guys, you've had composition courses, you know, in your undergraduate education, and they taught you the 5-paragraph theme where you start out with an introduction and then you have a couple paragraphs and then the 5th paragraph is the conclusion. And
yes. Yeah.
if you think about it, you know, what were you writing about in that introduction? I'm guessing it was some type of a problem or a specific idea that was going to set the stage for your thesis and what you would write about in the rest of the paper. You know, and so, you know, it's a problem introduction is an introduction. So, you know, if you were to precede that with some other type of introduction, I'm not sure what you would write about. I think you would find yourself writing about post-op nausea and vomiting. So,
exactly. That's exactly
so,
what it
I just,
felt like.
Yeah. So yeah. But yeah, you still, and I'm still getting used to 7th edition APA style, but I believe you still include the title of the paper. You still never include introduction as a heading.
Right.
The title of the paper is the first thing on the first page of the paper, which for us will be page 2, because you'll have your title page, and then page 2 is going to be first page of your paper, and it'll start with that title, just exactly as it appears on your title page, only just the title, and it'll be centered and typed in title case, and and then you'll write your paper after that, and then end with a reference list. So,
and we now bold the title.
Is that right? Oh man,
well,
I'm gonna have to be referring to the APA manual as I grade your papers.
Yeah, from my understanding, I've been trying to follow along with it as I'm like making my paper and such, and yeah, it's just it's taking some adjustments, that's for sure.
Yeah. Okay. Looks like I do have 2 unread questions in the questions forum, but one of those must be yours, I'm guessing. But does anybody else have questions? Otherwise, we can go look at those questions in the questions forum, and maybe I can get those answered for you before we conclude. Let's see. Yeah, oh, I just see that it's not really a question. Jessica just replied. He was explaining, so I understand. Okay, yeah, and then there's your question. Is there additional introduction prior to the, okay. Yeah, so I guess there's no additional questions in there really for me to address, but if you want, I can bring up the APA manual and we can look at the sample student paper in it before we close. I just got to make sure my screen will share, and then we can see what's supposed to be in bold. Yeah, because previously in the APA manual, you did not format the title that appeared on the first page of the paper in bold, nor did you format the heading of the reference list in bold. But from the sounds of it, that may have changed. So let's see. Paper elements and format. Oh, shoot, I'm trying to find the sample paper. I may not be able to do that. Things. Oh, here it is. Okay, I'm going to see if I can share that. All right, are you guys able to see the APA manual now? You should see, like, okay, great. It's so small though, I can barely see it. I'm going to see if I can move it over to my, oh, and then I lost it. Here we go. Okay. It almost looks like this, the title of the paper on the title page is also in bold. And then you guys know we don't require an abstract unless it's specifically specified. And then we got the title of the paper, which you're right, it looks like it's in bold. And then, yep, and it looks, oh, that's results.
We can't, or at least I can't see what you're looking at.
Oh, you can't. Okay. Let me see what I did here. What am I sharing then? Oh, it's because I moved it off my desktop. That's why I put it. Can you see it now?
Yes, I can.
Okay.
Yes.
I moved. I was sharing my desktop of my laptop, and I moved the APA manual over to my second monitor, so which I was not sharing. So that's why that happened. But now I got to get back to where I was. Okay. Which makes it smaller for me. I was going to scroll to the reference list to see. Yeah, it looks like references. The heading is also bolded, and you got more freedom with the font that you use. So I do think there have been great improvements to the APA manual. So that's a good thing. So anyway, yeah, I just wanted to show you that. It does look like those parts of the paper are bolded now, whereas they would not have been before. Only the internal headings in the paper, like the level 1 and 2 headings, would have been bolded. And for the problem introduction assignment, there's no reason to have any headings because it's too short. And using headings would actually kind of box you in and make it harder for the paper to flow, I think. So do not attempt to put headings in this paper. Let's see, anything else anybody wants to talk about? If not, we will conclude. And you guys can have a couple of hours to yourself tonight, maybe. Okay, well, hearing no questions, I'm going to go ahead and stop the recording and end the meeting. Thanks for coming and giving me someone to talk to. It's a lot easier to do this when I have students there, because when I try to do it when there's no students there, I tend to make mistakes and want to stop and start over. So this was good. So you guys have a good rest of the week and a good weekend, and I will be on the lookout for people's problem introduction assignments to be turned in on by Sunday night. All righty.
Have a good one.
You too. Good night.